Hi everyone. Today we are going to see about the overview of the safety vault. So, Vivo Vault Safety Vault unifies the adverse event management, ICSR intake, and submission on a single cloud platform. So here the adverse event in sense it is side effects of any drug. So the drug while which is producing and the clinical trial operations is happening. So that time you are finding any adverse events. So that will be coming up as a case. So other way is at the commercial side, after the drug has been induced by the patients, and that time the getting the any adverse events like any seriousness or any life-threatening cause coming up. So those also will be coming up as a case. So for that, individual case safety report has to be done. So that individual case safety report, in short, they call it as ICSR. So that flow will be covered in the safety vault. So where they will be doing the intake, triage. So intake in sense, the first thing that case before getting created, those details will be coming as through a gateway. So here the gateway they mostly they preferred is a E2B gateway. So through that to the vault safety that inbox will be just created. So once it is created, there is an custom actions they have to compare in the safety vault whether this case has already been created or it is a new case. Like that, the comparison option using the custom action options are available. That we can see that in detail in the later classes. But using that, this inbox will be generated as a case. So that they will call it as a triage. So once the triage verifies and creating a new case, so here comes up with the two process, which is case processing and the quality control. So here the data entry, the team will be reviewing those cases and adding up the details like effectiveness and expectedness. So they call it as non-expectedness or expectedness case. So if it is a non-expectedness case, that will be pretty straightforward and it will not give a bigger impact. There is no seriousness in that case. So those details will be covered, and after reviewing by the medical reviewers, they will be writing the case narrative using those details. And once that is done, the QC approval team will be reviewing those case details, and the main important point, they will be validating whether it is a SUSAR case or not. So SUSAR abbreviation of the SUSAR is it is a suspected unexpected serious adverse reaction or not. So if that is a SUSAR, and they used to blind the SUSAR or unblind the SUSAR. So blinded as yes, then the name of the case and the details will be getting hidden in the safety vault itself, so that it will be a restricted case and that has to be reviewed finally by the health authorities. So once the case is approved by the QC people, if the ICSR report satisfies, in the global thread, they will be validating it is a Medra or WHO drug. So these are all the two. The global level they have approved those details. So if that is been satisfied, then the case will be approved and automatically the submissions will be submitted. So submission in sense it will be submitted to the health authority, and the health authority will be reviewing. Before they are reviewing, they will be sending an acknowledgement message. The case has been received to them properly, and once the health authority team review it, they will be approving that case, and finally it will be into the safety vault. So there are two ways, the two options of moving it to the health authority. One is at the RIM side. So RIM side, the moving to the health authority again via the same gateway, but they will be creating the submission content plan. So that is basically for the new drug has to be allowed to be inside a new country. So for that, health authority has to approve that. So for that, regulatory vault also having a gateway to submit it to the health authority. Same way in the safety vault also they have a option to send it to the health authority through the E2B gateway most of the cases. So this is the overview of the safety vault. So you can go in depth into that and read more on that. Maybe we'll see that in detail in the next sessions. Thank you.